Safety tip number 15 is the use of blunt-tipped infiltration cannulas rather than sharp infiltration needles. Number 15, Tumescent safety tip number 15 deals with blunt-tipped infiltration cannulas. So we have designed Tumescent Lidocaine Anesthesia cannulas that are specifically designed for tumescent infiltration. We've called these Monty cannulas. And these have holes. For example, this is a cannula with holes that come down to this far on this blunt-tipped cannula. This one has holes that come down about halfway, and these come down all the way down to here. And these are used in a very specific fashion. This is the tip Monty, a half Monty, and the full Monty. Our typical pattern for infiltration is we use a little bit of do a little bit of the infiltration using a spinal needle. This is a 20-gauge spinal needle. So we will initiate the tumescent infiltration with a 20-gauge spinal needle just a little bit in the skin, under the skin I should say, in the superficial fat and mid-level fat, just enough to subsequently allow these blunt-tip cannulas to be placed with minimal discomfort. We don't use very much volume with this, but just enough to make the rest of the infiltration comfortable. Now, the full Monty, or the one with the holes all the way down, is placed through the skin, through an incision that we've made, and positioned under the fat and left in place while the tumescent infiltration pump, the peristaltic pump, pumps the fluid through here. It comes out in all of these little holes, apertures, and infiltrates uniformly along that pathway. If we had just infiltrated out of the tip of this, there'd be a rapid distension of the fluid under the skin, and that would be uncomfortable. This spreads that infiltration, that volume, over a larger distance and reduces some of that discomfort from this rapid distension of the tissues. And we can then move this from area to area very carefully, and in that way minimize any discomfort. And essentially, it's painless tumescent infiltration technique that we've developed. The fact that it's a blunt tip will minimize the risk of lacerating any blood vessels or nerves in the fat, and also avoid puncturing deeper tissue planes, reducing the risk of pneumothorax, reducing the risk of peritoneal puncture. So blunt tip infiltration cannulas are important in terms of safety. This concludes this video presentation. I'm Dr. Jeffrey Klein. If you should like some more academic information about tumescent lidocaine anesthesia, go to tumescent.org. If you'd like information about the surgical devices and tumescent infiltration equipment, go to hksurgical.com. Thanks.